How are you?
I am fantastic. And the doctor is, in fact, in. And, you know, Ricky, we are on the Touch BBC, BBCA page today. And so we're gonna share this with everybody because we want all of our breasties to be able to tune in because, you know, one of the things that I think is so hard about, you know, chemotherapy treatments besides the hair loss and nausea and all the other things is the fact that your fingers and your toes and all your senses get really weird and nothing prepares you for it. And, you know, there's a lot of things that sort of kind of almost quite work, but not really, which means that we get a problem on our hands. And it's a problem that's being addressed in some communities, not enough in our community, and that's peripheral neuropathy. So we got to talk about it today because it is an activity limiting thing. People who play instruments, people who knit. We have, you know, someone who's a teens who is a surgeon, and some communities, not enough in our community, and that's peripheral neuropathy. So you're going to want to mute that about it today because it is an activity limiting thing. People who play instruments, people who knit. We have, you know, someone who's a teens who is a surgeon, and some communities. All righty. Can you hear me now? Fantastic. Well, we are live. The doctor is in, and we are talking about peripheral neuropathy tonight because it is something that is a real Debbie Downer on a cancer journey, and the side effects can be lingering, lasting, long term, and it's something that, you know, we don't talk enough about in our communities, and we don't have enough good solutions for. So we're excited tonight. Ricky, how are you doing? How you feeling? I see you're on technical support over there too. You hanging in there?
I am hanging in here, but I'm having a little technical difficulties. I'm trying to get things going, but you guys keep talking. We have great,
fantastic.
We have some awesome breasties today, you know, and they're seasoned. You know, they've been here before, Mo, and they are phenomenal breasties. And I know Dr. Kodai just probably came out of surgery. Did you just come out of surgery, girl?
No, came from seeing patients, but I'm good. How are you?
Hi, everybody. How you doing? Would you introduce yourself for the people who don't know you? Because like Ricky said, you are a veteran of our show and one of our favorites in our breasties. But tell everybody who you are, where you repping from. Tell us your story.
So good evening, everyone. My name is Dr. Kodai Dikoto. I'm a board certified podiatrist with the Heart Center of the Oranges, servicing multiple municipalities within Essex County, New Jersey. I have privileges. I do surgery as well. Privileges with St. Barnabas Hospital here in Livingston, St. Michael's in Newark, and East Orange Hospital, and Livingston Surgical Center. I see a variety of patients, including patients who have diabetic and peripheral neuropathy, which we'll discuss tonight. And also the best part, I guess, I am a breastie, Ricky Fairley, obviously. I'm a breast cancer survivor with my last chemotherapy treatment being in December of 2020. So I'm freshly out and doing quite well and trying to kick some butt and support our sisters and brothers and the families who go through this by giving them good information with my lovely sorority sister and colleague, Dr. Mo. Huey.
Love you much.
Love that sisterhood. I love that sisterhood.
Yes. Sin, how you doing tonight?
How am I doing, or Sin?
Sin.
Oh.
You're on mute.
You there, Sin? We can't hear you. Wait. We can't hear you, darling.
Sorry.
There you are.
Sorry, I had used my keyboard to unmute. Okay. Hello, everybody again. My name is Cynthia Washington. I am doing fine today. Can you all hear me now?
Yeah.
Okay. I am a two-time breast cancer survivor. The first was in 2008 with DCIS, and the second was 8 years later with triple negative breast cancer stage 2A. I am a sufferer of neuropathy. So I was glad that Ricky invited me to participate in this dialogue.
And you know, actually, Sin, you told me about this. We talked about this, oh my gosh, probably last summer, that you wanted to talk about neuropathy. I think you were having a bout with it and not feeling well. And you said, we need to talk about this because I don't know what to do. And I don't know if there is something, you know, Mo, what do we need to do? Like, you know, why don't we let them tell their stories and we'll figure out what we can do about it.
Okay. Dr. D, you want to tell us a little bit more about, you know, the chemotherapy you had and just kind of how you manage some of the side effects, and even knowing what you know, but especially if you didn't know what you know about neuropathy, because you have some knowledge, and we should talk about what neuropathy actually is. So why don't we, why don't we start there?
Yeah, that'd be great.
So what is neuropathy? I treat neuropathy. Neuropathy is weakness, numbness, tingling, burning, usually of the hand and foot. When we see that and we have complete numbness, we call it stocking glove distribution. However, sometimes within cancer patients and other types of neuropathies, you can have loss of balance, you can have clumsiness, you can have facial pain, you can have stomach pain, you can have hearing loss, you can have problems with hot and cold. Those represent what neuropathy is, problems with the nerves. Causes of neuropathy can be diabetics, which is a big part of my practice when their blood sugar is sky high and they're not taking care of themselves. Patients who've had traumatic injuries, which I see, crush injuries, bad fractures or broken bones. Patients who've had bad infections, patients who are on toxins, which sometimes can be chemotherapy, as we know they're a certain toxin to kill cancer cells. Patients who have thyroid disease might exhibit it, and patients with vitamin B12 deficiencies. So that's what causes peripheral neuropathy. Test, which I'll get into, can be tendon. When in the office, we check your tendons. Remember that little hammer that people hit your knee with? Things of that nature, testing your strength. 2-point discrimination, meaning can I feel this point here and this point here? And something called a Semmes-Weinstein, which we use in the lower extremity, which is a monofilament, looks like a little piece of plastic. And we make you close your eyes and we just touch you on the bottom of your feet in different parts to see what can you feel. You can also do it to the hand. Blood tests, we check to see what your hemoglobin A1C is to see if that's an issue with your diabetes. Do you have any vitamin deficiencies? Some of the medications you take for diabetes can cause your vitamin B12 to go low and therefore start having these neuropathy or tingling types of feelings. Is your thyroid affected? Many women of color have thyroid disease, tons of them, and undiagnosed, and that can also complicate it. And again, some of the more invasive tests are sweat tests, which we do in our practice to see what's your ability to sweat. That lets us know that your autonomic system, which is a part of your nervous system, is not working. Autonomic reflexes, we check that as well. Sensory tests, can you feel? Nerve biopsy, where they may go in and find the nerve and take a clipping of it, or take a skin biopsy to see how the skin responds to that. One other big test, which I love and my neurological colleagues do, is called an EMG-NCV. It is a test that tests your response to electrical current for the NCD part and the response that your muscles do to the same thing. And you can find out a host of things based on that. And I'll tell you my experience, what happened with me. So those are the things we look at. We'll look to see in foot, we look for x-rays, as do my spine colleagues, orthopedic colleagues. Is there a malalignment? Is there something where your back ain't right, your foot's not aligned right? Is something pushing abnormally on the bone? CT and MRI for more soft tissue things where we don't see anything bone-wise and we want to get a better picture of an MRI, or CT where we do see something on the bone and we want a really good representation of what that is. And the treatment we can go into later, but my story is, yes, I do surgery. And when I think halfway through chemo, I started getting numbness in my hands, and that's like death for a surgeon. At that point, I was part-time and I had taken a hiatus from the hospital, but I was having numbness on my 5th and 4th finger and half of my 3rd finger, which is a nerve called your ulnar nerve, which happens on this side of the body. And it was scary for me because my thought was, will this go away? For many patients, it does not. Even with treatment, it's manageable, but it does not. And even if the nerve can heal, some patients get even worse symptoms after. God is good. I didn't have to take any medications. I was a vitamin person. I took my vitamin D, which is great for all your organs, at about 2,000 milligrams every single day. I took omega-7, which my oncologist recommended. And again, disclaimer, do not try these at home. Always speak to your oncologist first. Too many interactions. And thank God it went away. I did do an EMG NCD, and they said that the root of my nerve, which is coming up here, was irritable. And they knew it was from the treatment of chemo, which sucked. But eventually, as I came off of it, God willing, it's returned.
So that's really interesting because, you know, we tend to think of it as a disease or as a condition of the end organs, the tips of things, but yours was coming from somewhere a little bit further up, like in more in the central part of the nervous system.
Absolutely. Absolutely.
Wow, I think that's something we don't hear enough about because everybody thinks it's just the tips of the fingers and the toes, but neuropathy can affect any nerve, you know?
Absolutely.
So Cynthia, did you know anything about neuropathy before your cancer journey? And did you know that this was something to expect and how severe it might be?
I knew about neuropathy because I'm diabetic. I'm a type 2 diabetic. So I did know about neuropathy, but I did not anticipate it taking chemo. I was not told about ice treatments during chemo sessions and things like that. I didn't know about it until I got it. And like you said, it was in the tips of my fingers, but my foot about halfway from the base of my foot to the tip of my toe. So.
Wow. And tell me more about these ice treatments, because I think that some people know about them, some people don't.
Well, you know, you get to meet other breasties, and I met a breastie who happened to be my sister-in-law's cousin. And she and I were going through breast cancer. I went through it a few months ahead of her. And she had her treatment at NIH. And so she was like, well, did you have ice treatments? And I'm like, no, the only ice treatment I was told about was the ice cap for my hair. Right. I wasn't told about anything for my extremities. So she said that she had, and as a result, she did not suffer from neuropathy. And I believe what the process is that you actually submerge your hands and feet in ice. I'm not certain of how it went, but I understand that it did work for her.
Mm-hmm. Yeah, there are some studies. I think there have been small studies, but it's called cryotherapy. And so some people have worn frozen socks and gloves for 90 minutes, especially during their Taxol chemotherapy. And it's been published, I think, back in 2017 or so. So there are some studies that suggest that, you know, freezing your fingers and toes, just like you freeze your hair follicles, which it stands to reason, don't you think, Cordy, that, you know, by slowing down the metabolic activity of things like, you know, the nerves at the tips of the digits, you might, you know, circumvent some of the side effects of chemotherapy. What are your thoughts on that?
Absolutely. Because of the fact that we're so sensate on the plantar or the bottom of our feet and our palms, then those nerves are quite sensitive. We always think about chemo of the cells that are constantly regenerating or produce fast, like our hair and our skin, but the nerves distally are also regenerating because of the fact that we're constantly in touch. Oh, I feel this. Ooh, my foot stepped on that. So if you can slow down the process of the chemotherapy, that it can attack those cells, then yes, a lot of patients do feel well. I'd like to just talk about some of the treatments. So besides that, patients will come in and say, hey, you know, I have nerve pain. The question is, where is the nerve pain coming from? It's from your back. Then those patients may have something called radiculopathy, meaning that they have pain that goes down their legs. And the back, just like the trunk of a tree is the strongest, must be addressed no matter what. However, if it's peripheral neuropathy, meaning there's no cause from the back, it might be, in our case, chemotherapy that's causing it, diabetes that's causing it. Regardless of it, how do you treat it? So medically, there's medications you can go on. Antidepressants like amitriptyline, nortriptyline, which sometimes can make you feel, Opioids, which is a last resort because of the addiction that's in this country that people are now shying away from. Anti-inflammatories known as NSAIDs or ibuprofen and Motrin. Some patients respond, some don't. One of the bigger things are your anti-seizure medications, which is the gabapentin, the Lyricas, the Cymbaltas, which a lot of my patients go on, and they do get relief. Sometimes there's some patients who just don't, and I send them to neurology because they need something bigger and broader than I can recommend. Those medications, unfortunately, can make you sleepy. We try to make patients take them when they go to sleep, whether they work daytime shift or nighttime shift. TENS, which a lot of physical therapists use, podiatry uses, orthopedists uses. They're little patches that go on and emit a signal that you put on for about 30 minutes a day, and it helps counteract that nerve that's doing this erratic to calm it down. Physical therapists, because a lot of times physical therapy, your nerves, if your nerves are acting like that, you get weakness. Your hands, I remember I was trying to grab something one day and almost had a heart attack because I could not do it. And I had a whole meltdown because I was like, oh, no. And I had to do therapy because they thought I had carpal tunnel, but it was because of the chemo where I literally picking up stuff hurt. Plasma exchange they'll do, and they'll run your plasma, which is a part of your blood. They'll take out the plasma portion that has antibodies for patients who have inflammatory conditions. It's an immunosuppressant, meaning that can make you exposed to more infections. They're not as keen on that with cancer patients versus somebody who may have an inflammatory condition like lupus or something like that. And IV immunoglobulins, that's a big thing they're starting to do now also for neuropathy. But patients will ask all the time, what can I do, to protect myself at home? I tell patients, especially diabetics or anyone who has it in the foot, you must check the bottom of your foot. A lot of times, if you can't feel something, you don't know if something's forming. Ulcers can form, which leads to infection, and God forbid the amputations, as Dr. Mo knows I do. Wearing protective shoes, checking the shoes on the inside, the seam that they have. Sometimes that's annoying and you just can't feel it. Making sure that you use an anti-skid mat in the bathroom. People fall all the time. Making sure you're holding on to the railing, especially if you lose weakness, so that you don't go falling down the stairs. It happened to me once and my parents almost had a heart attack. Checking your diabetes, checking your medical problems, because if you have cancer and you got diabetes, those are two big things that are just pounding away at those nerves. And also taking your vitamins. Vitamins keep your body healthy, but without eating well, it's only a little bit, but it definitely helps with chemotherapy. N-acetylcysteine and L-carnitine are great things that people take. Again, asking your your oncologist that you can take it so there's no interactions. Mm-hmm. And, those are the best things I can tell you. I did many of them, and here we go.
And it works for some people and not for others. So, Sin, I wonder Absolutely. If you could paint a picture of, kind of what a day is like, I guess, when neuropathy really kind of flares up. Like, what things can't you do, and how does it sort of interfere sometimes, or try to interfere and steal your joy?
Well, my neuropathy never goes away. It's constant.
Really?
Yeah, it's constant. It's improved from the original level. I was very nervous at the original diagnosis because I was at the point where I could not drive because I could not feel the pedals.
Wow.
To drive. So that was very scary because I'm a very independent person. I like to move. I like to be on the go. Mm-hmm. Also, it made me prone to falls. I've lost my balance a few times when I was with people and they had to catch me. Going to sleep at night is sometimes very miserable because I haven't heard doctors speak of this particular feeling, but sometimes it feels like my toes are so dry, but not on the outside, but in the inside where you can't really reach it. It's like, and it seems like at night, that occurs mostly, not during the day. So
tell me more about that. What do you mean by your toes are dry? Is it itchy on the inside? Is it tingly? Is it burning?
I generally have a burning sensation with my feet. Okay. Generally a burning, but at night it's like my feet want moisture, but when I put lotion on it, it's not the answer. It's like it's beyond the surface skin, where it feels a dryness, like you would feel overly dry, like your skin was dry, and you would put lotion on it and it would feel moisturized. But inside my toes, that doesn't happen. You know, I put lotion on it at night and I'm still uncomfortable, going to sleep with the burning sensations at the bottom of my feet and,
Wow.
the dryness. And I'm sensitive to cold. My friends always, we take our shoes off when we go to one another's homes, but they always make sure, Sin, you got your socks because your toes going to get cold. So I'm sensitive in terms of cold. I need to make sure that, my feet stay warm. My fingers have healed a lot more than my feet. Those are some of the things that I go through. I'm sensitive to stepping on. If something is on the floor, it could be the tiniest little thing and I can feel it. And it's so weird. My daughter's like, Mama, I thought you said that your feet were numb. I'm like, they are. She said, well, how did you feel that? I'm like, I don't know. It's like it's numb, but it's extra sensitive. It's hard to explain.
Like the princess.
Dr. D, tell us why it's both numb and extra sensitive. Right. How does that, and then why some people have no sensation, other people have burning.
Absolutely. It depends on the extent of the neuropathy. And there's no, it's a continuum. Some people will fall on the low end, some people will fall in the middle, some people will fall at the end. Also, whatever the cause of the neuropathy is and how extensive that problem is causing it. We know that Taxotere and carboplatin are two agents that aggravate the hell out of the nerves and the foot and the hand. They suck, they're aggravating factors. We also know diabetics, the hemoglobin A1C, which indicates how controlled you are, diabetics who are under 7 usually don't have a problem. Once you start climbing over 7, there's some patients you can tolerate their hemoglobin at 10 and have no symptoms. There are patients who have it at 8 and are about to lose their mind. So it's all about how your body processes sugars and how the sugar then therefore damages the nerve. So what may happen for Sin may not happen for, Ricky, just based on the fact that maybe the dosages of their chemotherapy, their medical health, and how, if there was any damage to the nerve previously as well. But patients can have numbness. They'll say, I have numbness, and have what's called a hyperesthesia, where they feel every little thing. If I was to tickle them, they lose their mind because the nerve is so out of whack that it can't function normally. It's dying because it's damaged, hence the numbness, but it's because it's fighting it, it's overactive, hence feeling every little thing that she's feeling in her foot. Absolutely.
So Dr. D, you said a lot of big words.
And want me to break them down?
Yeah, I don't know if I got it. Can you talk to me like
absolutely? So if I tickle you normally without a nerve problem, you might be ticklish. But if you have a nerve problem, you might want to knock me on my butt for tickling you, because a nerve, literally, you can't stand it. It feels like 1,000 things are touching you at one time versus someone who doesn't suffer with that. It may feel ticklish, but not crazy ticklish like that. That's called a hyperesthesia or an overactive nerve. So when the patients, as Sin was saying, numbness, where you're like, I don't feel as much, but at the same time, if they were to be aggravated by something like a prick or a very light touch, the patient cannot handle it because it's multiplied by 1,000 versus someone who's not suffering with that, which makes it crazy because you're telling people you're numb, like you said, your doctor was like, how do you feel that? Because a nerve is fighting to stay alive.
Wow. I think it's a really good time to talk about the stages of neuropathy, especially for people who have chronic illnesses like diabetes, because sometimes when you can recognize these symptoms early, we can start to develop interventions for them. Like I noticed someone in the chat said, their family member had neuropathy and their doctors just didn't know enough about it, and it got worse and worse and worse. And so there are stages for neuropathy, and stage 1 is where you have that sort of numbness off and on, and then you have some discomfort. So maybe every couple weeks you have some, that pins and needly kind of sensation, but it doesn't, it's not persistent. It's not constant. So that's stage 1. And if you're experiencing that, you want to talk to your doctor, because sometimes it can be related to things like I get some recently in my fingers because of carpal tunnel. Right? Because the nerves that go through here, my median nerve and my radial nerve, I sleep wrong and I bend my wrist, or I sleep with my arm up in different ways, surgery, double gloving, lots of different things. Overuse cause my fingers to start to get the zingers down the tips of them. So stage 1. Stage 2,
I think that's what I have.
Mm-hmm.
As
And you
I
may,
don't,
there are tests for carpal tunnel too, you know?
Absolutely.
no, I
Yep.
mean my feet, a neuropathy in my feet, stage 1. I think it's because I never think about it until somebody talks about it. Like I can feel it right now because we're talking about it, but normally it doesn't bother me with it. But as soon as it's almost like when I see sin, I get it. But when I think about, if somebody says the words, I get it. I can feel it in my toes right now. It's so weird because after
Wow.
10 years, I mean, it's the weirdest thing, right? But like I have it right now. My toes are tingling.
And how bad was it for you, Ricky, when you know, because you were working and everything and you stopped working and, you know,
Didn't bother me. Didn't bother me in the moment at the
really?
time. And I think I had a little bit during chemo, but it wasn't nearly as bad what Sin is experiencing. But it's funny, like anytime I talk about or say the word, I feel it in my toes. So
Interesting. Wow.
So
A little reminder, huh? Constant reminder.
right.
I'd like to jump in for a minute on that. So
Yeah.
as you're saying about your stages, like stage 1, I'd probably say, hey, if it's tolerable, there's something called capsaicin, which is a topical medication made from hot pepper, as we would say in the Caribbean. The only thing was with capsaicin is that some patients can get skin irritation where they may break out from it because it's just an irritant. But for those who can tolerate it, in the mild stage of stage 1, they say it helps quite a bit for that extra tingly occasional feeling. That might be something that your oncologist, podiatrist, neurologist would give you if you're complaining about the state, it's being in stage 1.
It is actually what I recommend for my patients. And we talk about how it's important to wear gloves when you apply it and not to touch your eyes because it'd be like touching a red pepper, right? Like touching cayenne peppers and then rubbing your eyes. And so you want to be really careful if you do use capsaicin. It is over the counter, and to use gloves with it. And you may feel some heat at first, but then after that, it should dull the sensation and dull those nerves and kind of calm them down. So for people who have early neuropathy, capsaicin, you're right, is a great choice. And then it can progress, right, to more consistent symptoms. So more regular, it goes from stage 1 to 2. And the only difference is subtle. It's just that you're having it more often. And so here's where you got to start to figure out what's the underlying cause. Is it my diabetes? Is it a vitamin deficiency? Because like Dr. D said, you know, there's vitamin deficiencies that can cause you to have numbness in your fingers and toes and you don't even know it, you know. So when it becomes more regular, now you got to talk to somebody. And so this is a good conversation if you're a breastie or a cancer patient to have with your oncologist. If you don't know where to start, talk to your primary doctor and ultimately maybe see a neurologist because they can do some of those tests that Dr. D was saying to diagnose, is it coming from nerves up here or is it coming from nerves somewhere else? Or is it something in the diet that's deficient? Or is it something like a chemotherapy? So stage 3 is when it reaches its highest point. I remember being a little girl watching my grandmother who was a diabetic, kind of a brittle diabetic, and she would wake up at night and she would cry that her feet were on fire. And it was a constant burning for her. She'd wake up everybody in the middle of the night and she'd say, my feet are on fire. And we would have to try the different things. You know, we tried a capsaicin cream. She had a steroid cream. We tried lotion, you know, antidepressants, pretty much everything that we could find to try to put out the fire in her feet. And so that's stage 3 because those nerves are now damaged, but they're still overfiring. It's like sparks, like the car is trying to hotwire or something, you know? And so you still get that misfire. And it sounds like, Sin, you're living with a lot of that. And then it progresses to stage 4, which is like constant numbness because it's not carrying the signal to the brain anymore. Those nerve endings are pretty much, you know, it's permanent damage. And you can be between stage 3 and 4, you know, and so a lot of patients after chemotherapy, they end up at stage 2, stage 3, and sometimes it can be reversible, but, you know, sometimes not. Are there special shoes that you wear, Sin, that help you to sort of keep track of your feet? Because I have some patients that can only wear like Birkenstock sandals. And one of my patients, even in the winter, came to see me. She had on socks and sandals because she just couldn't wear any other shoes.
Well, I have large feet because I'm like 5'9", 5'10", so I'm pretty tall. I had a friend that really cared about my feet and bought me special tennis shoes with the extra inserts and all that, and that helped. But I would have to stay away from anything that had a pointy toe. I'm just beginning to wear some pointy toe shoes, for special occasions, but not for long, just to be, in that moment, and then take them off. But I wear a lot of slides, Nike slides I keep on, especially the ones that have like little numb things. I don't know what you call them, but they have like a rough exterior inside. So it kind of massages my feet. So I wear those a lot. But other than that, I stay away from pointy toes, unless it's a special occasion. And I try to wear the tennis shoes with the extra insoles to give my feet padding as much as possible. So those are the only special kind of footwear that I've been wearing, because I'm kind of conscious about my feet. So I want my feet to look good and whatnot. So
you're just a diva girl. Not your only your feet, your hair. Like
That's
she
right.
takes. Look at her Facebook page. She's like every day, the bomb, beautiful. Like, sometimes I look at him like, gosh, I better comb my hair.
But yeah, so that was the extent of my shoes. I wouldn't dare be caught in orthopedics.
Now I'm going to have to comment, Dr. Mo, right?
Come on in, go ahead and bring it from the podiatrist perspective, because she's going to give it to us.
Exactly. So I'm going to tell you that, even if you didn't have it, no one should be in heels over 3 inches. It can throw off your alignment of your back. And I know Mo was like, what happened? What happened?
Flag on the play. I got a closet full of 5-inch heels here. Hold on. What are you saying? Wait a minute, wait.
You have nerves between your bones and your feet. Those nerves can be inflamed, even from chemo and without chemo, simply from being overweight and the pressure that you put being so high up. And that can cause what's called neuromas. If you're a diabetic, a lot of times you have to be careful, as I mentioned, about the seam in the shoe and the vamp, which is how high it is and how it presses against you. Hence a diabetic shoe, even though they make them pretty now, because women used to complain all the time, they're making them look like Skechers, where they're cute enough, but protective enough so that ulcerations, skin irritations don't happen. So wearing a pointed shoe is pushing against the toes, and hence now you're pushing against the nerve in your foot, which is aggravating you because of the fact that you have neuropathy. You're exactly right. Wearing a heel does the same thing, because now you're pressing on these bones here, known as your metatarsals, and that's pressing against the nerve. So I would tell patients, there's great things Bionic. Bionic is a great line. There's Atrex. There's so many great companies that you don't have to get a prescription for, that you can go to the store. Dansco.
Can we put some of these in the chat, because I think that when people think of orthopedic and special shoes,
right.
It reminds me of being 5 years, 6 years old again with the black and white shoes, because my feet used to go in like this, and I feel like these special shoes also have very special looks and special costs. And I want people to know that there's some websites they can go to and get these. So if you get a chance, we're going to go to the Facebook and put them in the chat for sure.
If you put them in the chat in the Zoom, I'll put them on Facebook.
Okay, I definitely will. So with our diabetic patients and even our peripheral neuropathy patients, I'm always looking at what shoes do they have on, because you can complain that things aren't working. Well, what is aggravating it? And a lot of times patients, as you said, Sim, they don't consider their shoes. And then when I make them go into something else, I'm like, girl, you're right. Also flip-flops are not great because they don't offer support unless they're an orthopedic flip-flop, like Bionic offers something like that, and Atrex does too. So we have to be conscious of that, because we are trying to avoid skin breakdown, and we're trying to avoid open wounds like an ulcer, because that can happen even on a non-diabetic, simply because the way the shoe is built and what's aggravating on the inside of the shoe.
I love shoes.
So do I.
Me too. And I guess I have to transition into more cowboy boots, Ricky, because we love our cowboy boots.
I love our cowboy boots, and our cowboy boots are good, right? Can we wear our cowboy boots at least, Dr. D?
This is true.
Now, good and well, cowboy boots are pointy as they come. I've not seen a round.
No, but they don't have heels on them.
They don't have. No, I have square toe ones. I have some square toe, round.
I mean, if they're wide enough and that, it shouldn't feel like I'm crowding my foot. No shoe should feel like you're crowding your foot like this into it. The fact that cowboy boot,
they're totally comfy.
So if you have enough space, that's width. People think that if they go up a size, like I'm an 8 girl, let me get a 9. 9, that means length. Width is, are you an 8 medium? Are you an 8 narrow? Are you an 8 wide? Are you an 8 extra wide? And when you have foot deformities, such as bunions, hammer toes, and those things, you may need to go wider so you're not pinching on the foot. When you have swelling, which can sometimes accompany the nerve problems, you need to go wider. Having length makes your foot slide forward and it's just as bad. So if your boots are wide enough, Ricky, and you're not having a high heel, I don't have a major problem with that.
Good.
This does bring up a really good point of how to accurately measure your foot. I don't know how many of us, just like I always counsel patients about, finding bras that fit well and making sure you have not just the right cup size, but the right width and the right, all of the different things. But actually finding shoes that fit. Are there some things that we should look for when we go shoe shopping and get fitted for shoes?
Absolutely. Some of your better shoe stores still offer, remember that old school little slide thing to measure your foot, which is great. Some podiatrists offer it in their office as well.
Does that thing really work?
Within reason, because you need to know your length and also your width. Sometimes your shoe size, as we gain weight and we age, you can go up a shoe size. And if you do a lot of drastic weight loss, you can go down a shoe size. Sometimes it's not so much length as it is width, but people have to realize that, oh girl, my shoes don't feel the same. Whether it's looser or bigger, sometimes that's dependent on weight loss, age, and also foot deformities. So when patients tell me immediately that they have my shoes don't feel well, the first thing I look at is how do they walk in their shoes, which is a gait analysis. Are they favoring one side? Are they shuffling in their gait? Are they walking more on their tiptoes? Do they look like they're in pain? Sometimes a simple tweak of the size and width stops a lot of the problems. So those are important things to bring up. And I think that for neuropathy, especially if it's of the foot, your best bet is to see a podiatrist, because the most good podiatrists are going to look at all of that. Particularly someone like myself in a multi-specialty group, my colleague and I, who's a neurologist, we work hand in hand. So we're seeing MS patients, we're seeing the cancer patients with neuropathy, the diabetic patients. So the tests are being done. Pseudomotor, as we talked about, how well is your autonomic system, which is a part of your nervous system, how is that working? Cancer can affect so many parts of the nervous system that we need to know that. Unless your doctor is really listening to you, they miss that. And hence you start going from stage 1 to 2 to 3 and no help is being done. And that's a part of having a good doctor that's listening to what your complaints are. And advocating for yourself.
Wow.
It's a lot. It's a lot.
It is a lot. You're absolutely right.
So do you think since all of her neuropathy issues are more because of our diabetes or the chemo? Because you didn't have
no. My A1C is 5.1.
I wanted to ask you, Sin, but I didn't want to put you on the spot. But we are so proud of you.
Right. I have lost enough weight to come off of one of my medicines, and I'm supposed to come off my last medicine next month. I am very proud of that. So, but no, it started with the chemo.
Oh,
with the chemo, and I have always been a controlled diabetic. Once because it runs in my family. My sister is a type 1, and so I was familiar with the signs, and I kept watching myself, and I'm like, I'm becoming diabetic. So as soon as I noticed that the numbers went high, I went and sought the appropriate help. So I've been pretty much controlled. Two of my doctors tell me that I was their only controlled patient. So I.
Wow.
Wow. My patients, I they get, this is a look of happy, good time. This is a look of we could do better. This is a look of get it together. So.
I hear you. Now, what about some complementary and alternative therapies for this? Because if you go to the message boards, you will read a lot of different things. So supplements like magnesium, for example, CBD oil, different things. Are there any supplements and alternative or complementary, we'll call them complementary things that you're aware of that really kind of can help?
Okay, I'm assuming that question is directed to me.
Anybody.
Okay, some patients have tried reflexology. Reflexology works on some of the pressure points that relate to different parts and organs of your body. Patients have done acupuncture. Acupuncture has helped quite a bit. A lot of our insurances will cover it as a cancer patient. I know with COVID, some of that is stopped, which I never got to use it because of COVID, but though that's a complementary therapy. Magnesium, which promotes nerve health, is one thing. Again, don't take it without speaking to your doctor because you can take too much and become very sick. And N-acetylcarnitine is one, N-acetylcysteine is another. Again, don't take it unless talking to your doctor. People think natural sometimes means no side effects, and it doesn't, because it can interact with some of the chemotherapy medications you're taking, even the diabetic medications you're taking, and they can throw off your whole treatment at that point. So learning about it is great. The question is, does it interact? And your neurologist, your oncologist, are the best people to do that. Sometimes doctors will send patients out to a naturopathic doctor. And naturopathic doctors, there's one in the city who's fantastic, who will work with these doctors to say, you know what? Yes, because they have the knowledge. This medication will interact with carboplatin. This medication will decrease the effect of tamoxifen. For example, you can't drink grapefruit juice with tamoxifen. Don't do it. You can't take Benadryl with tamoxifen. Don't do it, you know? And a lot of times we just don't know that unless you're a physician. You don't know that. And even as a physician, sometimes don't even know that. They're like, oh, let me defer. So those are great complementary treatments, you know, but always defer to your oncologist to make sure it doesn't change your treatment or set you back in any way.
Yeah, I've had several treatments. My oncologist referred me to a chiropractor.
Nice.
And I was like, a chiropractor treating neuropathy. And so he said, yeah. So when I went to the chiropractor, they put me on a plan which consisted of a vibration treatment, a laser treatment, an in-office TENS treatment, a Tesla Max daily electronic treatment, and this drink called Longinine, which is supposed to increase the oxygen flow to your extremities.
L-arginine?
Yes, 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 yes. So they put me on that, and I did that therapy for 6 months, and it improved me a lot. So I was able to drive, and that was my main concern, because I didn't want to not be able to drive. And going to one of my support groups, one of my pink sisters, Karen, had said that she had taken acupuncture. So I did the acupuncture. So I did acupuncture for a year, along with a TENS with the acupuncture, and that helped as well. But like you said, when COVID came about, I haven't been since COVID. But you know, surprisingly, my feet seem to be improving without the treatment.
That's fantastic.
Yeah, I still have I still have it, but I can sense some improvement in the neuropathy. And my oncologist originally told me, you know, he said, well, in 10 years, your neuropathy will be gone. I'm like, 10 years? So I have been, how many years out? In June, it'll be 4 years from my treatment. So I'm like, okay, at 6 years, I'm gonna let him know whether the neuropathy is gone. But it is improving, you know. I also use a foot massager that was bought for me. It massages from the knee to the tip of my toes, and it has the heat and the vibration along with the massage, and that helps a lot. Also, my acupuncturist, she is Asian, and she had this tea. She called it a tea that I placed in a normal water homeopathic foot massager. I would put it in there, and she wanted me to have the temperature at 110 degrees, to put my foot in. And she said, you have to like kind of dab your feet until it gets used to the temperature. So I did that as well. So, and also of course, I went to my podiatrist, because being a diabetic, I had a podiatrist and would go on my regularly scheduled appointments. And my podiatrist prescribed a B complex vitamin. It's supposed to be some type of B complex vitamin. Huh?
Methanex.
Yes, that was the various doctors got together, put together. But I didn't really feel any different from that. So I didn't continue with that treatment. But, I was willing to try everything for relief and to get better.
Dr. Mo and Ricky, so what Sin was saying, first, the tea and the water, if you're diabetic, you have to be careful. I've had patients put their feet, as Dr. Mo knows, in hot water and come in with a 1st degree or 2nd degree burn, and that's a problem. But when you're neuropathic, meaning that you don't feel as well, should always be testing water right here. If it's too hot and you can't tolerate it, it's too hot for your feet, it's too hot for your hands. And many of my patients I just had a patient released from a 3rd degree burn because she thought she was going to soak her feet, and it cooked her feet. And we don't want that. So be careful of those types of things. That's the best thing I can tell you. And the Metnex is a megadose high vitamin B complex. It only works if the patient is deficient in vitamin B to begin with, because it gives you a big boost and you feel great. But if your vitamin B is at a normal level, then it's this extra vitamin B, which can be toxic at some people, and you have to be careful of that. Yeah.
Wow.
So,
Go
go ahead,
Ricky.
I was gonna say, so what can we do? Like, is there anything we can do during chemo to prevent neuropathy? Or like, how do you even know that you really have it? Because no one told me about it. And it's not, I actually looked on the chemo side effect list the other day when I was writing our e-blast about this, and neuropathy was not on the list of chemo side effects.
Sad.
I looked on a couple of different websites
Really?
to find it. No, go Google. I just Googled it randomly, Mo, to see if I could find it. And it doesn't tell you that neuropathy is a breast cancer side effect. Okay.
Wow. Wow.
I didn't know anything about it. And you don't know until you call the doctor and complain, why are my feet hurting? Right.
Wow.
But is there anything we could do during chemo, or can we give people some things to look for who are on chemo right now, like to look for, because they could be like me, having their feet hurt, but not know why. Right.
Wow. One, I think it's a failure of their doctors to, that they were not told. So when I talk to patients, and I'm a surgical oncologist, so I treat cancer with surgery, but patients want to know what to expect in the next phases. Like I give them the overview of here's what's going to happen to you. Here's your treatment journey. When you get to chemo, we talk about some of the side effects like hair loss, like change in taste buds, like neuropathy, like being hot and cold and sort of, bone pain, all the things. So to give them, not to scare them, but to give them a heads up that, we've got to make sure we have some tools in our tool belt to be able to manage these things. So I think one, it's a real travesty if that's not listed as a side effect, and if doctors aren't telling patients what to expect. But Dr. D, I want you to weigh in on some interventions if you know of any, and then I want to talk a little bit about like clinical trials and some research and things that we can do.
So you're saying, what can you do? The main thing is having a patient recognize that they're having it. There's nothing that can prevent per se neuropathy, short of just making sure whatever medical problems you have are in check. For example, your diabetes or thyroid, because now it's going to be even more a problem when you make taking medications that give you immune suppression, which is some of the medications you take for chemotherapy. Two, recognizing it. Wait a minute, these feet didn't feel like this prior. Now I'm a little tingly. What is that? And seeing your podiatrist and talking to your oncologist, and even being referred to a neurologist if need be. And I think that that's a disservice, as you said, Ricky, if you don't know what to look for because no one has told you that this is a possibility. That has to be something that oncologists are better at when they give you that packet that we all of us received. These are your possible risks. It was in mine. But then again, it's what I do. So I was already, looking for it constantly. And then when it happened, I almost had a heart attack because, my mind went in crazy mode after that. But the average person doesn't know that. So I think oncologists need to listen to their patients. Medical oncologists are usually the ones who are saying that, but surgical oncologists are just as great at that, and making sure that the packet that they're giving patients is comprehensive. Even if they have 10 patients who've had it, it's still a possibility. Maybe you might be number 11 and listed as part of the actual side effects that are potential problems.
Great, thanks. Gosh,
Dr. D, I have a question. Do you think as part of, because I know I had a lot of blood tests prior to my chemo, and you were mentioning that your vitamin B level, and that is that something that could be added to the list to make sure that your vitamin B level, if you're taking the Taxotere or Taxol treatments, could they check that prior to?
So I'm gonna answer it, and Monique, I know Dr. Mo is gonna jump in. Vitamin B12, I'm more concerned about for your diabetics, because some of the medications that you take can lower it. So if you were to come to me and say, hey, I'm a cancer patient and I'm diabetic, and I'm tingling, automatically we're checking that vitamin B12 level and your thyroid, because sometimes, again, women in their 30s to 50s who are of color have thyroid disease, a lot of times undiagnosed until it becomes a problem. They've lost so much weight, or on the other part of it, they've gained so much weight and they can't figure it out and blame it on menopause. So those are things to look at. But in terms of, and Dr. Mo can comment, I don't think that's regularly done for cancer patients unless they're talking about diabetes being one of the problems that they have.
Right.
I'm saying, do you think they should incorporate that?
Only if you're diabetic, I mean, or, you know, in terms of, and obviously when they're sent out to a podiatrist or neurologist, then that's more of the specialty of that specialist to say, let's check that, but not necessarily for oncology. No.
So I think when you go to see an integrative specialist, integrative oncology, or even just an integrated and holistic physician, they will check those perhaps more often than a medical oncologist who strictly practices, you know, sort of Western medicine. And they won't necessarily wait until you're symptomatic. And that's a double-edged sword because, you know, if you're not having symptoms and your vitamin whatever levels are just slightly below the curve, you know, do we really need to go to that extra length? One, and two, those tests are fairly costly. So insurance doesn't cover, you know, just sort of routine vitamin testing. And so patients are going to have to pay out of pocket for that testing. And I think that that is unfortunate. And it also leads to people getting infusions of things that they might not need. So we got to be a little bit careful there. But I do think that for patients who are symptomatic, for patients who have chronic illnesses, it would be really helpful. And I have often wondered and questioned my colleagues as well about how often we are checking the vitamin levels, especially for the ones that we know are directly correlative or directly related to these side effects. Are we really checking? Are we giving patients the best advice based on their profile and not just based on, you know, how we treat neuropathy for everybody? So I think it should be a more tailored approach to your points, and but not for exploitation. And I hate to see that sort of thing happen where, you know, there's a lot of there can be some exploiting of patients who don't feel well because they were checking all these random vitamin levels and giving them infusions of things that may not necessarily equate to helping them to feel better, right? Like it's a whole big picture, not just the little parts. So that's
covered by insurance, though, Doc. Why wouldn't it be covered by if it could be harmful to you?
Because it's not routine, because it's especially if you're not symptomatic, you know, from something, then why are we checking these things? You know, it's the same reason why, unfortunately, certain scans are not approved on patients anymore. Patients with early stage breast cancer can't get things like PET scans because, you know, the cost outweighs the benefit, so to speak, to the insurance company. Now, to the patient, that's a totally different story.
Right.
But to the insurance company, the cost outweighs the benefit because they're not likely to have distant disease. And so the insurance companies are banking on the fact that most people's vitamin levels live within a certain range. So if you want to start investigating every one of them and doing these long panels, they're going to charge you some out-of-pocket fees for it, you know.
And to tag on to that, she's right, because a lot of times when they submit your diagnosis code, I have to submit that I'm really not diabetic neuropathy and that the patient is symptomatic. Otherwise, they're not covering for that B12 test. 9 out of 10 times, even if it's negative, it's covered because the patient is symptomatic. I've given capsation. I put them on a Lyrica or a gabapentin because the patient's like, I'm losing my mind. This is what's going on. Is unfortunately, it can't be a pre-screening, but they're looking for the symptomatic patient, unfortunately.
But I do think, it's helpful. Go ahead.
Well, Dr. D and Dr. Mo, would you all be advocates of the ICE treatments on a widespread, you know, basis?
I think that it should be investigated further. I think the trials did not necessarily include African Americans. I think that they, you know, we saw some early results, but I think there isn't good long-term data. And I think that there should be more trials ongoing where we can see, you know, how this works and if in fact it works for more people. But the logic of it seems sound. And so I do think that if patients are severely symptomatic, and I think about it from the perspective of I were the patient, right? because there's one trial that's going on. I wanted to talk to you guys about this, but there is a clinical trial looking at chemotherapy-induced neuropathy in African Americans, in Black women stages 1 through 3. They're looking at the drugs. They're measuring, one, they're looking to see if we have certain genes or gene mutations that make us more susceptible to neuropathy. And then 2, they're looking at altering the dose. So they may cut the dose back. They may change the frequency. They're doing some things dose-wise to reduce the toxicity of it. And if it were me, before I change my dose, I would do things like ice therapy to my hands and feet, because I want my chemo to work to the point of a complete response. I want to see my cancer go away. And so I feel like when you alter the dose to lessen the toxicity, unless you know that my tumor is responding, you're messing around with the fact that my tumor might not be shrinking. And so, yes, prior to changing my dose, I would do things like ice therapy, or I would explore those things. And, you know, even if it means I just got to put my feet in the ice bath at home, you know, but if there's a way to participate in that, I think that it can potentially help. The risks of it are fewer than, you know, in my mind, than decreasing, you know, doses of important medicine. And so I think centers should be offering this. And I actually plan to talk to my center about it to see, you know, and maybe they'll say there's not enough data and it's expensive. Well, we got to look at how we can cut costs and how we can get companies to cover this and how we can get patients, you know, in community settings, especially exposed to things like this. Why should you only get it at Harvard or Hopkins, you know, or NIH?
NIH, right.
Exactly. I agree with Dr. Mo fully. You know, everything in unfortunate medicine is cost driven, and also cost benefit analysis, and also what clinical trials have been done to prove that it works. And so there are some centers that can afford to do some of the complementary therapy. I did my chemo at Overlook Hospital in New Jersey. I had a massage while getting chemo initially, until later COVID started kicking in. And I felt great. They even had a room for caregivers to make sure they got their 15-minute massage because they're stressed out. So versus maybe doing something at Newark Beth that does not offer that. So it all depends. Unfortunately, it's driven by economics, which is unfortunate, and your insurance and what they cover. Would I, again, with the ice bath, I've looked up some stuff myself because of neuropathy, and I haven't seen a lot of data, just like Dr. Mo says. So I wouldn't necessarily, you know, do that. And for my diabetics, no, because again, some of them are stage 3, stage 4, where they can't tell if the ice is giving them, which ice can do, give you a burn. And now we're in the hospital treating it.
Gosh.
Wow.
We have enough to deal with, you know?
Yes, we do.
This is one of those areas where it's really important to tap into how you feel and not to say, oh, maybe it's just the chemo, or maybe I'm supposed to feel this way, you know, because if there's some things we can do to intervene, whether it's TENS, whether it's acupuncture, whether it's CBD oil or vitamins, you know, we want to know as early as possible so that we can try to intervene and stop it before it becomes more progressed. So, you know, got to say something.
So
well, it seems like my neuropathy has always been stage 3, stage 4. It was you know, it just jumped right on. It didn't feel progressive at all.
So when did you figure out when it was neuropathy? Like, would you just call your doctor? Like, how did you know that you had that?
I knew my feet was numb, and I knew neuropathy had to do with numbness.
Okay.
And so
from your diabetes, you knew that from your diabetes experience.
Right. Not from my
Nobody told you, though, your oncologist didn't tell you.
No.
Yeah, Ricky, you would never know. If you're not a diabetic and you're an oncologist, you have no idea of what that is. You know, it's a curse and a blessing that you're a diabetic sin, but it helped you know, wait a minute, you know. But for you, Ricky, how the heck would you know?
I would know. And then also, I wouldn't even know to call a podiatrist.
Exactly.
Right? Like, what doctor deals with this? We need to write an article about this, about, you know.
We do.
Because I think people just need more awareness of it. You know, you think that 5 minutes with your oncologist when they tell you, yes, Ricky, you do have breast cancer, or that how long is that doctor visit? And we're going to give you all this stuff, and here's your chemo, and here's your thing, here's what you're going to do. Like, there's no time to even get to this topic, right? As a potential effect.
Exactly.
And no one's telling us this stuff. I mean, half of the stuff that we talk about on the show, Mo, it's because some doctor didn't tell somebody in that meeting that took 5 minutes, that they gave 5 minutes to.
Yeah. for whatever reasons, whether they're trying not to overwhelm a patient who's already overwhelmed, whether they're trying to just get to the root of, get your surgery or get your port in, get your chemo or whatever. I think you're right in that, these conversations don't happen enough. And I think, we don't utilize services like podiatry enough until we have an issue, right? Like, just like we talk about things like breast health, right? Like foot health. Podiatric health is something that we should be talking about more, not just when you get a bunion, not just when you got a hammer toe, not just when you get diabetes, but what does that look like as part of your routine sort of preventive maintenance? Is there somebody you might need to check in with to go over, your risk factors and talk about how to protect your feet, and how to preserve your feet? We go to a dentist to preserve our teeth, right? But we don't check in with doctors like this. And so I think there's some education around prevention and sort of general health maintenance too that we need to be having.
Right.
Absolutely.
Right. Wow.
We definitely got to have this conversation again. And
Absolutely.
And more props, let's get that TENS unit. Let's bring in some things. Let's start to expose people. What are the glove and the ice bucket and the hands and the things? What do they look like? What should people be asking about? How much does it cost? Are there grants out there? Like, let's do some digging and let's come back with some solutions, because people in the chat are really, they're suffering. And, we're throwing a lot of stuff out there. Right. But now it's up to them to figure out where to start. So let's do some digging on some stuff that works and bring back some props, some ideas, some grants, some experiments, and some things that have worked for us. So
yeah, Sin sent me a bunch of pictures of a lot of stuff she's been through, and we actually posted her feet in our e-blast. I don't know if you saw the picture, but
those are yours. Oh,
those are my feet.
But also
my acupuncture.
I know, huh? But she showed me also like these booties that you had on, right?
That's the laser treatment.
Right.
That was the laser treatment.
I've never heard of the laser treatment. That's definitely a chiropractic thing, because Dr. Mo and I looked at each other like, all right.
That's a laser treatment. It's like booties and it wasn't a long treatment, but you could see the little red laser lights going up and down from just below my knee all the way down to my foot. So he called it his 5-point program. So I don't know if there's anything else left for me to try. I did go to another doctor. He said that the only thing left for me to try was to lose weight, and I'm on that journey now. He said that losing weight, he thought, would be the only thing else that would help my feet. Because I guess you got all the weight on the foot, which doesn't really help with the neuropathy. So absolutely. I'm on that journey now. Well, I've been on that journey for a while, but I haven't reached the goal yet.
1 pound
process. Yeah.
For every pound you lose 5 pounds of pressure off your foot. So when patients are like, my aching
really
feet,
wow,
yes, you do. So I have
say that again.
Say that again.
For 1 pound that you lose, you can lose 5 pounds of pressure off your foot. I've had patients lose 10, 15 pounds and like, girl, I feel so much better. I've had patients who are morbidly obese go through gastric sleeve and other weight loss surgeries, and they've had chronic heel pain, and it's gone when they lose the weight. So weight has a lot to do with pressure on the joints and the lower extremity. And that's something that definitely, even the nerves, when you have neuromas or inflammation of the nerves between your feet, weight loss is a great thing. And I highly recommend it.
Well, that explains why my feet are feeling better, because this month I have lost 20 pounds. So I guess that's why my feet have felt better. So yeah.
Well, you go, girl.
Yes.
And you've been doing a lot of work on your body, girlfriend.
Incredible. Wow. This has been an incredible conversation.
Absolutely.
No, I know. It's like
I've learned a lot.
Have you learned a lot? And have you really ever talked to other breasties about your neuropathy? Like, have you found anyone to like be a buddy with to get information?
Well, just through SOCI, my support group, but of course all that stopped during COVID, but that was a topic of conversation. I did, my chiropractor did come to one of our support groups and explain the process that I went through, because I explained to the members that I wasn't able to drive. I would drive maybe to the local store because it was one light and that was it. But I said, now I just zoom up and down the beltway, you know, and I feel confident, you know, I feel confident that I know the gas, I know the brake. So I had him come in and speak to the other breasties. So that, you know, and just whatever I've expressed on the shows that you've invited me to be on, that's the basically the only time I've shared with, you know, shared with the breasties.
Well, thank you so much. Thank you, Dr. D, so much for sharing words of wisdom.
Yeah. Wow. How can people reach you? How can they find you, follow you, support you, engage with you?
Yes. So I put my professionally as Dr. Decoto, podiatrist. I'm with the Heart Center of the Oranges, multiple locations within Essex County. As I said, I'm affiliated with the hospitals as well. So I put my heart center stuff. For my breast cancer advocacy, because I do have one, I have an advocacy called KD Styling, which is all things health, wellness, and beauty for people affected by breast cancer, their caregivers, and those who support us. With my own YouTube show, which Dr. Mo has been on, called Talks with Dr. D. I will put that here, Ricky, so you can put that in the big chat. And I'm always available for people to email me if they have questions and to talk. And I'm on shows like this in different groups around. So holler at you, girl.
Awesome.
You're very outspoken out there, and you know we try to share a lot of your posts too, Dr. D. We'll continue.
Thank you.
That. Yeah. And Sin.
Yes, I did hear Dr. Mo say something about trials. Am I eligible?
I'll send you the link.
Okay.
I'll send you the link and we can explore together.
Okay.
That's great. That's awesome.
How can people reach you, Sin, if they have questions or want to, you know, share with you and chat with you a little bit further? Can they follow you on social media?
Yes, I'm on Facebook, Cynthia Washington, and I don't mind giving my email. It's C as in Charlie, M as in Mary, wash57@msn.com.
Awesome. I put the link to that trial in our chat here, so that you can read about it a little bit further. But you know, every Wednesday night for over a year now, we set out to provide some relatable and reliable and real information about breast cancer for our breasties, about life with it, about being victorious over it, about, you know, trials and research for it. And so we hope that this has been that for everybody, because, you know, as Ricky said, as all of our guests have said, this is something that we're not talking enough about, and we don't hear enough about it until after we're diagnosed with it. So we encourage you, do some research, bring us your questions, bring us your stories, your success stories of what's working for you. We want to hear from you on Touch BBCA Facebook page. So please do chime in so that we can encourage each other and get better and get beyond this thing, you know, because we got a lot of stuff to do and too many cute shoes to wear to be tied down with the rockets.
Too many shoes. I can't wait to go out to wear my shoes, you know, you guys.
Yes, indeed. I miss it. I miss it. So we love you guys. Thank you so much.
Thank you for inviting me. Thank you.
Thank you for inviting me back. It's been fun.
Absolutely. And
next week we're going to do breast cancer and MS.
All right.
Wow.
Gotta talk about another tough topic.
Yeah, another tough topic. We thank you, Amgen, for supporting us. And
Amgen.
Yep. And this will be available on the blackdoctor.org Facebook page, correct? On Friday at noon. We're going to replay this. So if you have, you know, seen it and you want to share it with some friends, please let them know. Friday at 12 p.m. We're going to be airing this on blackdoctor.org. So, and you catch us next week at our regular time.
Yep. Take care, you guys. Breasty love. Breasty love. Thank you so much. You guys are awesome. Thank you.
I love your hearts. That's great.
You guys have fierce hair today. Fierce hair.
Thank you. Okay. Thanks, doctors. Thanks, Ricky. Talk to you soon. Bye-bye.